Among the ever-evolving world of cosmetic operations, there is one trend that has captured the interest of celebrities, influencers, and regular people alike: butt microneedling. The practice of microneedling, which was once limited to dermatology offices for the purpose of rejuvenating facial skin, has now spread to other parts of the body that have traditionally received less attention. This contentious and frequently misunderstood operation has become increasingly popular in the gluteal region, sometimes known as the buttocks. This region has developed as a hotspot for the procedure, especially after television anchor Kelly Ripa reportedly tried it, which prompted a rush of inquiry and a wave of internet controversy. The procedure has recently made headlines, particularly after it was rumored that she tried it. However, what exactly is butt microneedling, and why are people, ranging from celebrities to wellness enthusiasts, responding to this desperate cosmetic treatment technique? What is butt microneedling? In its most basic form, microneedling is a minimally invasive technique that involves the generation of controlled micro-injuries in the skin through the utilization of very small, sterile needles. Collagen and elastin are two proteins that are necessary for the suppleness and firmness of the skin, and these micropunches stimulate the body's natural healing response, which in turn prompts the synthesis of these proteins. Microneedling has traditionally been utilized by dermatologists for the treatment of facial issues such as fine lines, wrinkles, acne scars, and uneven skin texture. The technique, however, has lately been modified by practitioners so that it may be applied to greater parts of the body, such as the thighs, stomach, and stomach. Butt microneedling is a technique that is specifically designed to target the gluteal area, with the goals of reducing cellulite, tightening sagging skin, and improving the overall texture of the skin. The method, in its most basic form, utilizes the skin as a canvas, stimulating the natural regeneration processes of the skin with the intention of producing a more young and firm appearance. The technique is occasionally combined with other treatments, such as injections of platelet-rich plasma, PRP, hyaluronic acid, or topical serums, all of which have the potential to further improve the hydration, tone, and suppleness of the skin. Dermatologists believe that these additives have the ability to enter deeper into the skin through the microchannels that are generated during the process of microneedling, which in turn amplifies the outcomes. How come the butt? Even while the gluteal region might not seem like the most obvious location for a cosmetic surgery, there are a number of reasons why people are looking to enhance their appearance in that area. Reduction of cellulite. Cellulite, which is characterized by a dimpled look of the skin and is produced by fat deposits pushing through connective tissue, is a condition that affects roughly 80 to 90% of women at some point in their lives. Although there are non-invasive alternatives available, such as lotions and massage devices, it is believed that microneedling can activate collagen surrounding the fibrous septae, thereby smoothing the skin from the inside out. Skin rejuvenation. Sagging or stretched skin on the buttocks can be caused by a number of circumstances, including advanced age, fluctuations in weight, and lifestyle choices. The collagen-boosting effects of microneedling have the potential to, in theory, assist in the restoration of firmness and resilience. Aesthetic enhancement. In addition to the functional enhancement, there are certain people who are interested in the surgery for reasons related to their appearance. When combined with additional cosmetic efforts, such as butt lifts or exercises, a smoother and firmer posterior can provide a more toned and sculpted appearance when combined with these efforts. What the process actually entails. Despite the fact that the procedure itself is not particularly complicated, the concept of having needles placed on the buttocks can be somewhat terrifying. The duration of a normal session might range anywhere from 30 to 60 minutes, depending on the size of the region that is being treated. As for what you can anticipate, prior to the procedure, the skin is washed and, in certain cases, anesthetized with a topical anesthetic in order to reduce the amount of discomfort experienced. Microneedling is a technique that involves moving a handheld instrument that is fitted with fine needles, which may occasionally be adjusted in depth across the skin. Due to the needle's ability to cause micro-injuries, the body's natural healing reaction is triggered. Application of serums. Application of serums or platelet-rich plasma, PRP, to the treated area may be performed depending on the practitioner and the patient's goals. Because of the microchannels, deeper absorption is possible, which should potentially result in increased efficiency. When the treatment is finished, the skin may appear red, somewhat swollen or painful, which is comparable to the appearance of a mild sunburn. Recovery normally takes a few days, and the results start to show up gradually over the course of several weeks as the production of collagen increases. Despite the fact that the technique is touted as being minimally invasive, specialists warn that it may be necessary to undergo numerous sessions, typically 3 to 6, with a few weeks in between each session in order to achieve obvious effects. It is also possible that maintenance treatments will be suggested in order to maintain the improvements over time. Kelly Ripa's desperate procedure, an example of the celebrity implications. However, the discovery that Kelly Ripa, the longtime co-host of Live with Kelly and Ryan, purportedly got the treatment, was the catalyst that actually launched butt microneedling into the public consciousness. The treatment was described as desperate by entertainment news sites, which sparked curiosity as well as a number of different reactions, including criticism and fascination. There is a huge amount of weight that is placed on celebrity endorsements, whether they are purposeful or unintentional. In a society that is preoccupied with youthful appearances and body perfection, fans and media sites speculated about Ripa's reasons for doing this. Was it solely cosmetic? Was it a preventative strategy against aging? Or was it simply a part of a burgeoning wellness trend that she wanted to explore? Microneedling is a relatively low-risk approach that can enhance skin without the need for surgical intervention, according to dermatologists. This is true even for high-profile persons. The dermatologist, Dr. Lisa Salerno, who practices in New York, adds that celebrities frequently look for treatments that are not only successful, but also do not involve a significant amount of downtime. Microneedling is an excellent method for treating this condition, particularly when it comes to targeting areas such as the buttocks, which are not as frequently exposed in daily life as the face or the hands. Warnings and things to think about. In spite of the fact that it is becoming increasingly popular, butt microneedling is not risk-free. Due to the fact that the technique includes puncturing the skin, there is a possibility of infection, bruising, or hyperpigmentation occurring. It is possible that patients who suffer from specific medical issues, including as skin infections, keloid scarring, or blood clotting disorders, are not potential candidates for the procedure. The results are also subject to variation according to the expert. Some patients may have a substantial reduction in cellulite and smoother skin, while others may only notice a slight difference in their appearance. The induction of collagen varies depending on factors such as age, genetics, and lifestyle. As Dr. Salerno points out, it is possible that certain individuals will require multiple sessions in order to reach the desired effect, and the results acquired are not permanent. Furthermore, the adjective desperate, which is frequently used in headlines in the media, may be a reflection of cultural biases associated with cosmetic treatments. Others believe that butt microneedling is a personal option in body care, comparable to hairstyling or cosmetic dermatology for the face. While some people may perceive it as extreme or driven by vanity, others maintain that it is a personal choice. What the science says about it. The wound healing cascade, which consists of 3 steps that overlap with one another, is stimulated by microneedling. These phases are inflammation, proliferation, and remodeling. As a result of the microinjuries, growth factors are released, which in turn prompts fibroblasts to produce collagen and elastin. After some time has passed, this results in skin that is thicker, more resilient, and has better suppleness. There is a possibility that the skin will experience increased hydration and structural support when combined with platelet-rich plasma, PRP, or serums that contain hyaluronic acid or peptides. A study that was conducted in 2021 and published in the Journal of Cosmetic Dermatology discovered that the application of microneedling to various parts of the body, such as the thighs and buttocks, resulted in statistically significant changes in skin thickness and a reduction in the appearance of cellulite over a period of 12 weeks. In spite of the fact that it was encouraging, the study highlighted the fact that the outcomes were slow and required repeated sessions. The data demonstrate that microneedling is not a miracle cure, but rather a method of progressive rejuvenation that can be used in conjunction with other lifestyle measures such as exercise and nutrition. Increasing popularity and trends in social media. In addition to receiving endorsements from celebrities, butt microneedling has also acquired popularity on social media platforms such as Instagram, TikTok, and YouTube. There is a common practice among beauty influencers and wellness accounts to provide before and after photographs, video instructions, and recommendations for hospitals. There has been a significant increase in the number of people using hashtags such as numbered butt microneedling, numbered booty glow, and numbered skin rejuvenation, which indicates that the interest is extended beyond the realm of celebrity circles. And rise in the number of requests for butt-focused microneedling treatments has been reported by clinics. We've seen a significant uptick in clients specifically asking about collagen induction for the buttocks, says Dr. Monica Feldman, a cosmetic dermatologist in Los Angeles. We've seen this increase in the number of clients. Many people are motivated by a combination of aesthetics and skin health, including the desire to have skin that is smoother and firmer as they age or following changes in their weight. Various alternatives to microneedling of the butt. There are a number of alternatives available for individuals who are worried about needles or who are looking for new options. The use of non-invasive lasers in laser therapy has the potential to stimulate collagen production and diminish the appearance of cellulite. Heat-based treatments, such as radiofrequency treatments, tighten the skin and improve its texture simultaneously. Topical creams. Creams containing retinoids and caffeine have the potential to temporarily smooth the skin. However, the outcomes are not very impressive. The use of targeted glute workouts can enhance muscle tone and lessen the look of sagging skin. Workouts that focus on strengthening the glutes are also beneficial. In order to achieve the best possible outcomes, specialists frequently advise taking a combination strategy, which involves combining minimally invasive treatments such as microneedling with lifestyle modifications. From both a societal and an ethical standpoint, despite the fact that the treatment is becoming increasingly popular, it also raises questions about the demands that society places on body image. The way in which Kelly Ripa's experience is portrayed as desperate is reflective of a larger societal struggle between the autonomy of the body and the judgment of the government. According to Dr. Samantha Gray, a psychologist who specializes in body image, people are often quick to judge cosmetic procedures on areas like the buttocks because they are private and highly sexualized. However, for many people, these treatments are about gaining self-confidence, achieving personal satisfaction, and gaining control over how their body changes over time. The discussion around butt microneedling connects with broader questions in the field of cosmetic medicine. These debates include the role of celebrity influence, the ethical implications of selling procedures to vulnerable populations that are seeking perfection, and the balance between empowerment and societal standards. To summarize, the bottom line: butt microneedling is a growing trend in non-invasive cosmetic enhancements that offers a potential solution for cellulite, sagging skin, and textural irregularities. Although the media coverage has sensationalized some celebrity experiences as a result of the procedure, experts emphasize that the procedure is relatively safe when it is performed by licensed professionals. Additionally, the process should be viewed as one component of a holistic approach to skin and body wellness, alongside other components such as exercise, nutrition, and skincare. Potential patients should assess the benefits, dangers, and costs of the operation, keeping in mind that the results might vary and frequently require many sessions. In the realm of cosmetic procedures, the decisions that celebrities make frequently have repercussions that extend far beyond the realm of red carpets and talk shows. Recently, Kelly Ripa, a longtime television host, made headlines after it was reported that she had undergone an unusual cosmetic procedure known as butt microneedling. This is a trend that is increasingly capturing the attention of the public and encouraging heated discussion. Despite the fact that Ripa has always been admired for her youthful appearance and her dedication to wellness, her decision to embrace a treatment that was once considered out of the ordinary or desperate has sparked curiosity about the reasons behind cosmetic interventions, the science that supports them, and the societal pressures that drive such choices. This is the procedure that everyone is talking about. Butt microneedling is a cosmetic procedure that is minimally invasive and is designed to improve skin texture, reduce cellulite, and stimulate collagen production. In contrast to facial microneedling, which has become a mainstream practice, microneedling of the gluteal region is relatively novel and frequently raises eyebrows in both professional and public circles. The technique involves the use of fine needles to create tiny punctures in the skin, which triggers the body's natural healing response. This results in an increase in collagen and elastin production, which promotes firmer and more resilient skin. Additionally, the procedure can be paired with serums or platelet-rich plasma (PRP) injections for enhanced results. This allows nutrients and growth factors to penetrate deeper into the skin through the microchannels that are created during the session. The allure of such a surgery is obvious for a celebrity like Kelly Ripa, since it is minimally invasive, involves little downtime, and has the potential to be a supplement to her hard fitness and health routine by providing her with additional benefits. Kelly Ripa's participation, the influence of celebrities in the workplace. The participation of Kelly Ripa is what has caused this process to suddenly become the subject of headline news. Her willingness to publicly interact with a cosmetic treatment that is relatively unknown has heightened curiosity and prompted both appreciation and criticism. Her move has been referred to as desperate by various media outlets, which is a term that reflects both the novelty of the procedure and the societal perceptions of cosmetic interventions on body areas that are considered private or taboo. However, experts have pointed out that celebrity participation frequently serves as a catalyst for the popularization of new treatments. Celebrities have always been trendsetters in beauty and wellness, says Dr. Lisa Salerno, a New York-based dermatologist. When someone with high visibility like Kelly Ripa tries a treatment, it immediately becomes part of the public conversation. People want to know if it's safe for her. Could it be right for me? In point of fact, previous cosmetic innovations, including as face fillers and non-invasive laser procedures, have followed a similar trajectory, obtaining popular acceptability after being endorsed by prominent personalities. The reasons why this option is stimulating conversation. The severity of the dispute surrounding Ripa's operation is caused by a number of causes, including the following. The butt microneedling process is not as well known as other cosmetic treatments due to its unconventional character and the fact that it is performed in an intimate setting. This causes eyebrows to be raised and talk to be sparked. Celebrity transparency. Ripa's openness about trying the surgery stands in contrast to the world of cosmetic modifications, which is frequently a hidden one. This encourages conversation about body image, aging, and personal choice. Societal judgments. The treatment has been referred to as desperate in certain media outlets, which is reflective of cultural attitudes that examine cosmetic procedures on private areas, particularly when they are undertaken by older adults who are looking for rejuvenation. Influencer amplification. Social media platforms have played a vital role in sharing information and structuring public opinion. Hashtags, celebrity beauty blogs, and online forums examine the process, its benefits, and its possible risks, further fueling controversy. The appeal and the scientific justification for the procedure butt microneedling is a procedure that, at its core, stimulates the natural healing processes of the body. The tiny punctures encourage collagen production, which ultimately results in skin that is smoother and firmer. This procedure provides a non-surgical alternative for individuals who are experiencing cellulite, sagging, or texture irregularities in the gluteal region. Microneedling, even when performed on sections of the body other than the face, has been shown to improve the suppleness and thickness of the skin over time. Combining this method with platelet-rich plasma, PRP, or topical serums can enhance the skin's ability to absorb growth factors, which could potentially lead to an increase in the effectiveness of the treatment. The technique provides a low-risk method to maintain the firmness and texture of the skin, which helps to support an overall image of youthfulness and wellness. Because of this, the attractiveness of the operation is not limited to only cosmetic reasons for celebrities like Ripa. Curiosity, admiration, and criticism were the responses from the public. A variety of responses have been received in response to Kelly Ripa's operation. Some fans respect her dedication to self-care and her willingness to explore new therapies. On social media, individuals praise her transparency, framing the process as part of a larger discourse about wellness and aging gracefully. Commentators argue that media coverage can amplify unrealistic standards, reinforcing pressure on ordinary individuals to pursue similar treatments in order to feel socially validated. On the other hand, critics describe the move as desperate or frivolous, questioning the necessity of cosmetic interventions in body areas that are largely undisclosed to the general public. As a psychologist who specializes in body image, Dr. Samantha Gray makes the following observation. Celebrity cosmetic choices are often scrutinized more harshly than ordinary decisions. Public figures like Kelly Ripa are navigating a world where their bodies are constantly under observation. Their choices can inspire, but also invite judgment. Cosmetic trends and the effects of aging in a more general context. The decision that Kelly Ripa made needs to be understood within the context of a larger social structure. Cosmetic operations that do not involve any invasive procedures have seen a meteoric rise in popularity, particularly among populations that are getting older. Fillers, laser treatments, and microneedling are examples of minimally invasive techniques that offer alternatives to surgical procedures. These choices enable individuals to keep young appearances with a reduced chance of complications and a shorter recovery period. Rather than being a matter of medical necessity, the label of desperate that was assigned to Ripa surgery indicates more about cultural preconceptions. The pursuit of aesthetic enhancements, particularly in less conventional areas, is a personal choice, and it does not necessarily indicate desperation. According to physicians who specialize in cosmetic dermatology techniques, according to Dr. Ganters Salerno, the term desperate is frequently used to emphasize the sensational nature of coverage. When it comes down to it, people seek these procedures in order to improve their health, self-esteem, and confidence. Accepting responsibility for one's physique and looks is not in and of itself an excessive behavior. Because of the influence of celebrities throughout history, celebrity endorsement has been the driving force for the penetration of beauty treatments from specialized clinics into the mainstream. Take, for example, the rise in popularity of cosmetic procedures such as Botox, lip fillers, and chemical peels, all of which received widespread acceptance after notable figures publicly discussed or were photographed undergoing these operations. But microneedling has taken a similar road to becoming more visible as a result of Kelly Ripa's involvement. The power of celebrities to impact health and cosmetic trends is shown by the fact that beauty influencers are sharing information, tutorials, and personal experiences, and as a result, clinics are reporting a rise in the number of enquiries they receive. On the other hand, specialists warn that the curiosity of the general population should not take the place of medical guidance. Despite the fact that celebrities such as Ripa have the ability to raise awareness, treatments should exclusively be carried out under the supervision of competent doctors. Warnings and things to think about. It is important to note that despite the attention, medical specialists stress that microneedling does not come without any risks. Among the possible adverse consequences are that the treatment site may be accompanied by redness, swelling, or soreness. Minor bleeding or bruising may occur. If the post-treatment care is not enough, infection may occur, uneven skin tone or hyperpigmentation that is present. Furthermore, the outcomes differ from person to person due to individual characteristics such as age, genetics, and lifestyle choices. In order to maintain the changes that have been made, it is possible that further sessions will be required, as well as maintenance treatments. It is essential for anyone who is contemplating the treatment to have a thorough understanding of these aspects, regardless of whether they are motivated by a celebrity endorsement or a personal interest. Contextualization in the media and the language of desperation. The manner in which the media portrays cosmetic operations has the potential to greatly impact how the general public views them. Particularly in the instance of Kelly Ripa, phrases such as desperate are attention-grabbing, but they might not adequately convey the goal or the medical rationale for the situation. According to the opinions of several experts, this kind of framing frequently reflects the discomfort that society has with aging, cosmetic augmentation, and talks of bodily parts that are deemed private or even forbidden. When language is sensationalized, it has the potential to stigmatize personal choice and maintain beauty standards that are not realistic. Words are important, as Dr. Gray puts it. When the media characterizes a process as desperate, it conveys a subtle message that pursuing betterment is humiliating, particularly in areas relating to femininity or sexuality. This is especially true in regions where the operation is being discussed. A more nuanced reporting style that strikes a balance between information and empathy is required. Autonomy, personal responsibility, and self-care. Although there is some disagreement, many people support a more empowered point of view. But microneedling and other cosmetic treatments are examples of practices that can be included into larger self-care routines. A lifestyle that places an emphasis on wellness, exercise, and body care is something that celebrities like Kelly Ripa have adopted, and the surgery is only one component of that lifestyle. Reframing cosmetic operations as personal choices rather than desperate measures is something that psychologists say might help eliminate stigma and foster healthier talks about body image. Treatments such as microneedling should be understood in context rather than sensationalized, regardless of whether they are motivated by worries about aging, issues related to appearance, or the desire to improve confidence. A concluding statement regarding the intersection of celebrity, culture, and the development of cosmetics. The experience that Kelly Ripa had with butt microneedling is a great example of how celebrity engagement may help raise awareness of novel and unusual cosmetic procedures. The decision that she made has prompted a conversation on body image, the effects of aging, and the pressures that society places on people's physical beauty. Despite the fact that some people consider her acts to be desperate, others acknowledge the sense of empowerment that comes with selecting one's own aesthetic path. A larger trend of non-invasive treatments that are gaining traction among high-profile personalities as well as the general public is represented by the technique itself, which is scientifically anchored in collagen stimulation and skin renewal. The spotlight moment that Ripa experienced ultimately sheds light on the intricate relationship between the impact of celebrities, the framing of the media, and the public's infatuation with the ever-evolving field of cosmetic improvement. It emphasizes the significance of distinguishing sensational storylines from educated decision-making, and it encourages fans as well as regular people to make decisions regarding cosmetics in a manner that is deliberate, safe, and free of shame. Regardless of whether they are planned or accidental, celebrity endorsements continue to be a significant influence in shaping the public's image of beauty and wellness trends. This is something that becomes abundantly evident as the topic moves along. And with celebrities like Kelly Ripa moving into the spotlight, even the most outlandish cosmetic operations are making their way into the conversation of the general public.